so now I'm going to be performing the procedure hang-in IV solution. So before I begin, I'm going to see if I have the right patient. So I would have to ask the patient, look at the wristband, and then look at the MAR. So my patient's Anita Bath, birthday is 4/11/2000. I would take a look at the wristband, Anita Bath, 4/11/2000, and then the MAR, Anita Bath, 4/11/2000. So then I would wash my hands, and I would look at my order, and I have 0.9% sodium chloride, 1,000 milliliters over 6 hours. I would compare that to the MAR. And then before I begin, so knowing that I have the right patient, I'm in medication because I have the 0.9% sodium chloride, 1,000 milliliters over 6 hours. I have to make sure that I have the right dose, route, and time, so I double check that between the order and the MAR. And now I'm going to take a look at my IV solution. So I have an IV solution right here, and I have to take a look at the wrapping, see that it hasn't been opened, take a look at the expiration date, take a look to see that it's clear, not cloudy, and that there's no precipitation, that it's not leaking. Okay, so it's a good bag and it's a good solution, so now I'm going to open it. And then, so I have the right solution now. So now I'm going to open up my IV, well, because I did my 3 checks. So medication room, I had the right solution, I performed the right math, and then I came in here and I performed the checks again, the right patient, solution, dose, route, and time in the medication room, right here in front of my patient. And now that I'm setting it up, I'm going to make sure that I have the right solution, patient solution, dose, route, and time, because now we're going to administer the medication. So I have this, I'm going to hang it up. Okay, so now I'm going to attach the IV line to it, the prime tubing. Comes in this kit, so I have to be careful. So it's open, must have been old, but it looks clean and in good use. So now I'm going to make sure that I don't touch it anywhere, that I keep the tubing clean. So then I'm going to spike the solution here. So I'm going to take off the top, and I'm going to spike it. Okay, so perfect. Now I'm going to attach this here. Well, we can leave it like that for now. So the clamp is closed currently. Okay, so now I'm going to open the clamp, and I'm going to fill up the drip about halfway. Okay, great. So then I'm going to have it go all the way through the tubing, keep it above the waist. I'm going to put it in the container there. Okay, that's good. So I'm going to tighten it back up so it stops going like that, stops leaking. Alright, so the next thing I'm going to do is I'm going to place this here for now. We're keeping it clean, so I'm not letting it touch anything. Alright, so now I'm going to wash my hands. I'm going to put some gloves on. I'm gonna take this off, clean up the area that I'm gonna use. Before I do so, I need to inspect the area. So on the patient, so on the IV site, so I have to look for redness, pain, and swelling, and it looks fine. There's no redness, pain, or swelling. So I'm going to switch it like this, and I'm just gonna wash my hands one more time. I noticed I touched my glasses, so I want to make sure that it's clean. So I'm gonna clean the area here, hub, for 30 seconds. Okay, now I'm going to take this off the top, insert it, and I'm gonna insert this, all 3 milliliters. Perfect. This is to clean area. Make sure it's irrigation. Next, I'm going to take the alcohol pads again. I'm going to clean it one more time. And there was no edema, swelling, or pain as I did that, so my patient is in ready shape to receive this IV in solution. So I need to clean the area one more time, 30 seconds. I'm going to take this IV prime tubing and attach the prime tubing right here. Make sure it's tight and ready to use. Alright, so it's on my patient. Make sure nothing's pulling, my patient's comfortable. And I'm going to assess the site again. There's no redness, pain, swelling, no edema. There's no phlebitis, infiltration, or extravasation. There's good color, no blanching. So it's all set. So now I have to prime the pump here because I measured out everything, and I'm checking one more time. I have the right patient, solution, dose, route, and time. So now I'm going to make sure that you see this, so I got to zoom. Regular circumstances, we're going to try to keep things still and clear, clean, and okay, but this is not a regular circumstance because I'm recording. So it's all hooked up here, so you can see that. So right now I'm going to turn it on, and I have to set my rate, BTBI, and it's processing. So now I gotta press enter, A, and the rate is gonna be set for, so so then we're gonna turn on here, press start, and then yes. Okay, so now my pump is working here, and it's going at a rate of 167 milliliters per hour over 6 hours. So then we're going to, this is all set, this is great. So I'm going to move this back, and I got to assess my site again, so there's no redness, irritation, or swelling. Okay, this is okay. It's set on the wrong one, so set this one. Alright, this is okay. So now my site's okay. Redness, no redness, swelling, pain, no phlebitis, infiltration, extravasation. My patient's tolerating well. And then my patient is tolerating it well. So the date today is 9/9/2020. Time it's 1:30 approximately. I would double check to make sure. And then the amount. So we're going to do 167 ray milliliters per hour over 6 hours. So that is everything. Amount and time. Alright, amount over hour. Okay, so my patient's tolerating it well and everything's good, so I finished my procedure.